Hi, friends. If you are a parent and you have a child who snores, mouth breathes, grinds their teeth, has dark circles, trouble focusing, behavior issues, or even if you are looking to possibly avoid braces, then this is the live for you. I'm going to be joined by Dr. Kalli Hale. She is an airway-focused dentist. Pillow, which is the program that we used for our son to help him with his airway and ultimately get back on track from his snoring and all of the issues he had been having over 7 years. Hi, Dr. Callie. Thank you.
Hi, thanks for having me.
Yeah, I'm so excited to have you because you are just one of the most amazing airway dentists and
Thank you.
helped create the program that ultimately helped our son. And I'm forever grateful for that because I don't know what we would have done otherwise. And so finding help in a world where parents are dismissed and trying to find solutions for their children, it's
Oh,
hard. And so I
yeah.
wanted I wanted to come on here with you and see if we can talk a little bit about airway health, what it is, and I would love to just talk a little bit about you and
Sure.
what got you into airway dentistry and what ultimately guided this path.
Yeah, well, I would love to. First off, thank you for having me, so Shauna. It's so nice to talk with you tonight, and it's just an honor that I was able to help your boy from afar, and I love that. And your story is very powerful. So, I have a fairly unique story in dentistry. I come from a family of dentists. I'm actually one of five in my immediate family, so I grew up in dentistry. From answering the phones and filing paper charts back when things were paper to running a huge teledentistry company to provide airway services to kids. So it's been just a wild journey and one that I am immensely grateful for. I did an extensive postdoctorate training in obstructive sleep apnea with the intent actually of treating adults. My whole goal when I went to this program was to know how to help adults that could not tolerate their CPAP, that were grinding their teeth or whatever. And there was this massive pediatric component to my education that I was like fairly dismissive of. Like, honestly, I was like, I don't really intend on treating kids. Like, this whole quarter is not going to be for me. And boy, was I wrong because I learned things that I literally couldn't believe that I was not taught in dental school. And I really feel like I just hit the ground running after that. I'm like, every mom deserves to know this. Every child deserves a good sleep at night. And to think that I can provide that with something as simple as a tooth pillow was just like, I want to shout it from the rooftops. And I have done nothing but that since.
Yeah, it's really remarkable. Once you go down that rabbit hole, there's like no going back. And I've gone down lots of rabbit holes as a mom, and it's come ultimately from a place of me not feeling like I had help from the
Right,
medical community, and I had to go find the answers
right.
myself. And every time I would go down a rabbit hole, I would find more. And then sometimes I would come on, dead ends and try to find solutions. And it took a mom telling me about this for me to learn about it. And it's just set this entire path. And it's amazing to hear that even as a dentist, like this conversation isn't happening. So it's not
Absolutely.
happening in dentistry, it's not happening in any of the other medical fields. And the more I go down this rabbit hole and recognize like no one's really dealing with
That's right.
the airway other than airway dentists, it's quite
And
fascinating.
yeah, and it's hard for moms to navigate too because there aren't that many of us right now. And it is definitely more and more popular, I think, thanks to Toothpillow over the last like decade, I would say that dentists are paying more attention. But you're just not going to be able to go to anybody on the end of your street or wherever to get a proper airway evaluation. And with just my heart for this and the people that helped me, the other founders of Toothpillow, I was like, how can we bring this to the masses? And I believe it's going to be my legacy. And I wanted a Toothpillow to be a household name.
Yeah.
And it is becoming that, which is just wild for me. And I commend you for researching it on your own. And I see moms that, maybe they can't do that. Maybe for whatever reason, like can't intake the information well enough to understand what it is they're looking for. And those are the kids that are being given bad advice sometimes. And how are you supposed to know one way or the other? You're not the dentist. Like, we should all just be providing very similar care in that regard, but it's not. And yeah, I didn't learn it in dental school. In all of my pediatric rotations, it was never discussed. And I'm at the point now where I'm like, it's like the only thing we need to be
I
talking
know.
about. Like, it is the mouth breathing is the number one cause of tooth decay, in my opinion. And it's like, if our kids are mouth breathing, they're not sleeping well, they're not growing, they're not recovering, their brain health. I dig into literature every single week, and there is more and more coming out about pediatrics and lack of oxygen and sleep.
Yeah, and then you have the AAPD
Yeah.
now recognizing this, and the ADA has since 2017. It's really coming around, and I'm so excited to see how that continues to grow.
Me too. Me too.
There's a lot of parents on here that are going to be listening who may say, like, what the heck is airway health? It was a question that I didn't know either. And so for those that are just starting to learn about this, like, how would you break down what airway health is at its core?
Yeah, so you just really need to be able to breathe through your nose. Like if I had to take it, this massive problem and just putting it into one thing, it should be that your child should breathe through their nose while they're sleeping. And so many kids don't do that. And they have allergies, they have whatever symptoms, or their tonsils and adenoids get swollen, or whatever happens, and they start to mouth breathe a little bit. And it may not be enough for the parent to notice at first. You're probably not sleeping next to your kid every night, perhaps. You don't know that to see that, but they'll start exhibiting other behavior. But at the very core, airway health means that you are breathing at night, all night, without stopping breathing, without having any pauses and disturbances, noisy breathing, any of that. And your child just goes to sleep, you guys included, us adults too, lips closed and breathing through your nose.
Yeah, it's I didn't know that I'm a mouth breather because typically my mouth is shut when I'm just at, like, speaking or not speaking,
Yeah.
just like hanging out, right?
Yeah.
My mouth's shut, like
Right.
listening to you here, my mouth is
Yeah.
shut. But I now realize that I mouth breathed like in my sleep my whole life. I grinded all my canines
Yeah.
down. Like I have, symptoms that are from mouth breathing at night. And I now know, like, I wake up with a dry mouth, like I've always drink water at night,
Wow.
and
Yeah.
I try mouth tape in my body, like in my sleep, I just rip it off. And so
Mm.
I think it's important because I see a lot of parents say, my kid doesn't mouth breathe. And they probably do. It's just like statistically, what is it? Like 90,
Absolutely.
almost like what, more than 95, 98% probably of us have
Of
some
sleep
sort
disordered
of
breathing. Absolutely.
dysfunction. Yeah. And so it's not always obvious. It can be slight. But as an airway dentist, you're able to recognize in the face and the jaw structure, like
Absolutely.
whether these symptoms exist. And before we get into that, I would like to discuss what are some of the symptoms that come from this type of mouth breathing and airway issues overall.
Yeah. So generally speaking, kids that have what they call sleep disordered breathing, which mouth breathing is a component of that, will have daytime fatigue, but they don't manifest it like adults. They're not just sleepy. Now, some kids will fall asleep in class. They will actually be more hyperactive. You will hear them snoring, you will hear them grinding their teeth. There are, I would say, like my top 4 or 5 would be those three, also bedwetting. Like
Mm.
bedwetting blows my mind that as a dentist I can do something about that. I'm like, I work up here, it's like so crazy, but the body works to be in homeostasis. And we see an incredible amount of symptoms that kids are dealing with every single day in the United States that we consider to be common signs of being 7 or 9 or 10 or 12, which they're not normal. They're just common.
Mm.
And that's a problem. So tooth grinding, snoring, mouth breathing. Allergies are going to cause more mouth breathing, which means your tongue is going to be lying low. And then you've got the hyperactivity, anger issues. I treat the most of severe kids in my practices in Texas, and we see kids that are heavily medicated for sleep disorders and really being tired. And that is so heartbreaking. But getting them into a tooth pillow and seeing that change their life and help them to get off medications is a whole other rabbit hole that I could go
Yeah.
down.
No, it is. And it's, a lot of parents are sent to the doctor or a specialist and they're just told, like, oh, it's normal. Your kid's going to grow out of it. It's
Absolutely.
like, just like a few more years, like,
Right.
and parents just go like, okay. And then they wait. And then the problems don't resolve themselves
Right.
and often get worse. And so it's interesting because there's just this huge disconnect as far as like how to treat these symptoms, or and they're all being dealt with separately instead of looking at like what the root
Yeah,
cause is. And I know it's a rabbit hole with the medication, but like it's just a band-aid for like what's going on to try to like
absolutely.
suppress it, and not
Right.
like what caused that to begin with and why is that on the rise.
Yeah.
So
It absolutely is. And I mean, when you go all the way to what is causing the body inflammation, what does their diet look like? What, as a whole, it can be really overwhelming as a parent to try to figure out.
mhm.
And I think when we can take a piece of this and tell them by looking at photos of their child and reviewing their medical history and doing our sleep questionnaire, that we have a validated tool to help them to start overcoming things like hypoxia, low oxygen, that is happening to your kids when they're not breathing and sleeping well. And yeah, you might have an allergy issue. You might have environmental allergies or food allergies or have something else going on, but this is something that's going to help them no matter what in the interim while you're trying to figure the rest of it out.
Yeah, and you saying that about like the low oxygen intake, I look back and I feel so sad about
Mm,
like my son's story.
yeah.
Um, I like get sad about it because like thinking all the way back to like all the years of us trying to figure out what was wrong with
Right.
him. And I even like asked the doctor at one point, I'm like, can you test him for autism? Like there's something like not
Wow. Oh,
connecting. I'm like,
it's
the
my
lights, the
chills.
lights aren't all
Right.
on upstairs. Like something is wrong. And they're just like, he's fine. And then I'm like, can you check if he has adenoids or tonsil issues?
Yeah.
She like literally looked in his mouth and it's like, I don't see any obstruction. And I'm like, well, you can't see adenoids like that way. And we went to a different pediatrician because I'm like, something's wrong here. And the new pediatrician, like as soon as she saw him, she was like, no, you need to go to an ENT. Like something's wrong.
Wow.
And she talked about like the risk of going into like a possible surgery and whatnot versus like the oxygen deprivation that he had
Wow.
been
Yeah.
experiencing. And I was just looking at some old blood work the other day, and his
Wow.
oxygen like I can't remember what the exact one it was, but it was like so low and it was red. And it was like it was
Wow.
a red flag at that time, but they
Yeah.
never said anything
Yeah. That's
about it.
wild.
And so now to think back, like how he went through essentially at the time, like 7 years of his life at
Yeah.
that deprivation of oxygen and like functioning and like trying his best.
Yeah.
And I'm over here like probably frustrated at him for things that like
Oh,
he couldn't
I know the
control.
mom guilt is real, but don't. I mean, like you were led and found the path for him, and you are super mom. I know you are. But it's so hard. I mean, we all have mom guilt, but you went to multiple providers, and that's the part that I start losing my patience for because this is not new. This is not trendy. This has been around a long time,
Mhm.
and there is plenty of literature to support what we're doing at Toothpillow. Whether your child gets referred in office for expanders or we can do everything virtually, this is a validated product. This is not a fad. This is not a DIY direct to consumer sort of just one size fits all. And that is an important thing for people to understand. We are a whole cohort of incredible airway dentists across the United States that know what the heck we're doing. And it is heartbreaking to read the submissions that Dr. Morali and I have to screen through before they get sent to the state level treating providers. I literally go in there and I'm looking at hundreds and hundreds and hundreds of kids. And they have been multiple places. They've spent thousands of dollars. They've got medication now, which I never fault a family for. Like by the time they get on these medications that I see some of these kids on, a whole lot of hurt has happened.
Mhm.
And a whole lot of knocking down doors to try to find resolution has happened. But I haven't met a parent yet that wouldn't get off of those medications that they thought they
Right.
could. And that is where we can change their life by making sure that their brain is healing, that they're oxygenated during sleep. And it is so critical. So you found it, and he is beautiful, and everything's going to be fine. But I understand it's also just sad that it had to be your responsibility to find that. And hopefully that's what we're changing.
Yeah, and like you're just dismissed, and it's like, but it does feel good when you find the answer, and that's why I've made a choice to create such a platform sharing about this, because out of all the things I've shared online or in any way, like nothing has been as important as this message. And
Well,
I've,
thank
you know,
you.
if I like you see all these children and you want to help them, like I look
Yes.
at it the same way. Like if I can be that mom that helps another parent find this,
Yeah.
because the doctors aren't talking about it. And I'm curious your thoughts on like, why do you think there's such a disconnect in, even like ENTs who are working with what you would think would be responsible for the airway. Like if I were to pick a profession that I
Yeah.
think should deal with the airway, it would be an ENT.
Right.
And when you go to your ENT, which we had to do, they basically just have the solution of removal of the obstruction, which is usually adenoids or tonsils. So my
Okay.
son had his adenoids removed at 2.5, and by age 5, he was snoring again. And I was very confused. And I then noticed his tonsils getting large. And I started questioning, like, why are we just removing
Tissue.
this instead of like figuring
Right.
out what caused it? And
Right.
that's what led me to Toothpillow. But why is there such a disconnect there?
The education's just not there at all. And I mean, that's the easiest answer I have for you is that if you are never taught a solution or a cause besides, oh, it's like their food or the environment or whatever, you're not going to know to say anything else. And it's
Mhm.
not ill willed, it's not intentional. I have dear friends that are ENTs. I also have ENTs that I won't refer to because they want to take them out only if you've had strep X number of times a year. Like, and parents have videos of their kids stopping breathing and they're still like hitting up against a wall. But
Mhm.
the idea that we could actually shrink them, that's where the really good ENTs are leaning totally on airway dentists now. They're like, we have literature to support the maxillary, which is your upper jaw expansion, can shrink tonsils and adenoids statistically
Yeah,
significantly.
my
So now that
son's
this
went
stuff is
down.
out, yes, the ones that are paying attention, again, they're busy, they're running a business, they home, they want to be with their kids. Like, who knows? Like, we can all relate to that story, but there's too much information now for us to be continuing to tell patients the wrong information.
Mhm.
So now, some people are very against tonsil and adenoid removal. I understand that. I have a very, I think, strict sort of thought process on that. If I have a patient in my chair that is young, 3, 4, 5, I'm really truly concerned about what they call intermittent hypoxia. The amount of information that's coming out about that and the irreversibility of some of that in a growing child, I don't have any patience for. But I also really know what I'm doing. So I can look at a child and assess where their tonsils are. Obviously, can't see the adenoids right away, but
Mhm.
where their tonsils are at that time, and can they tolerate a tooth pillow? Because if I can get them in a guidance appliance and they can get air in through their nose without harming them, without having any issues, excuse me, then I know that I can shrink them.
Mhm.
If they follow my protocols, I know that I can help them. But there are kids that by the time they find me, it is way past too late and we have to remove them.
Yeah.
And it's also shown that it's not as successful when they only take one versus the other, unfortunately. Like, if they're going to go in, they should take both. And we're seeing that when they only do one and not the other, usually the root cause, aka mouth breathing or whatever's causing it, isn't going to be the end all
I'll
solution.
let you get some water.
Thank you.
Talk.
I was
Um,
joking.
yeah, no, um, I, I now realize, the mouth breathing is a factor in this inflammation, because we're supposed to breathe air through our nose, so it gets
Yes.
filtered and warmed by the time it hits the adenoids and tonsils.
Right.
And then, versus mouth, where it's like just abrasive, like when you're sick and your nose is plugged and
Oh
you
my
wake
gosh.
up and your throat
It's
hurts,
awful.
dry. These kids
Yeah.
are going through that every day. And and then also factoring in the bone growth, because I have my son's x-rays like before and after doing this program, and he has like insane like growth, forward growth, and like you
Yes.
can literally see his airway is open now.
Yeah.
And his tonsils shrunk. And I have a video on my wall of like, I was filming him for something and he opened his mouth. I think I was trying to show his teeth or something, and I was like, oh my God, your tonsils. And he's like, ah. Like, it was such an exciting moment, because he was really invested in
Right.
like those tonsils going
Right.
down, because he didn't want to go to surgery either,
Yeah.
and I didn't want to go
Well,
through it again, because it was like,
absolutely not.
I
Yeah.
was like, this is my proof of like whatever I'm doing is working, and I
Yeah,
want to keep them. Like I want to see them go down. But if worse came to worse, we would have done the surgery.
of
So I'm like
course.
really grateful that we were able to shrink them naturally. And
Yeah.
I'm sorry, I have notes because I want to not forget
Yes.
like certain
Yeah.
questions I have.
Sure.
But one of the questions I would love for you to explain, because I get a lot of comments on my posts that it's a different child, that there's no way that this is the same kid, that I'm using trickery in my photography, different lenses. Like I literally get these comments on every single post, and it's my son, and I'm like defending that this is my son. I don't have like a treasure trove of children that I bring out and for my pictures to compare.
Yeah,
But what has happened is that his face has changed so drastically in a short time. And he is wider. You can see like his smile, like everything is so different. Can you explain a little bit about why this program, like in doing guidance appliances, helps to change like the way the facial structure should be?
absolutely. And I have to giggle when you say that because I have also had doctors mainly DM me when I show before and after pictures. Usually on mine, it's teeth. Sometimes it's profiles, like what you're talking about. And they just, when the results are so good, they can't wrap their mind around it. I don't know what to tell them besides it really is that good. Like,
Yeah.
but basically, your jaws are going to grow in the way that they are stimulated. And what I mean by that is your mandible. So let's talk about the lower jaw, because when we're talking about those nice profiles, we want there to be a downward and forward growth to the mandible. And when your jaw is open, like this, because you're a mouth breather, it literally gets stimulated for the growth in here to grow vertically. We don't want vertical growth. We want forward growth. And so your son before was growing in a more vertical pattern, and it would
Mhm.
have continued to happen that
And
way
that's the time
unless
like that
something,
reset.
yes,
Yeah.
unless something came in and stopped that. And basically, with the lips being closed and wearing these guidance appliances, the tongue is resting at the roof of the mouth again, like it's supposed to. And when your mouth is closed and your tongue is up, it stimulates the growth to go forward. So people look at this thing and they're like, how could this do anything? Like, honestly, like I've even had dads in my practice be like, what? We're buying what? Like, and I'm like, yes, and it's the best freaking thing you'll ever do for your kids. So I don't want to hear about it. And I get all like fired up because they don't, I can look at a kid and know what it's going to be at the end.
Yeah.
And that's what's so cool after treating that many cases for so long. So the profile is a ever changing, I think, in a child anyway as they're growing. But when you get them to change the trajectory of the way it's growing, that's where people are like, wait a second, like, how can that happen? And you were really just bringing him back to what they call normal anatomy.
Yeah. Yeah. What we should look like.
Yes,
And now I look around at everybody and I'm like,
me too. Me too. Me too.
I'm like, I'm so sorry. I'm
I
like judging all of this because
I
like
know.
I see it in myself. My husband, I've talked to my husband. I'm like, he has like a large smile and a large tongue, but he still has a narrow jaw. I'm like, you really should have had like this crazy
Yes.
massive like smile. Like,
Yeah.
like he really should have.
Right.
And so it's really like I said, an interesting rabbit hole when you go down, because like you can't unsee it
It's so
everywhere.
true. And it's
So
I'm plagued by it. I mean, you have it too, but me being a dentist, it is like absolutely, I'm like,
sure.
do I say something? No, don't.
Yeah.
Like, or if I'm on an airplane,
Like
I'm
I
like,
could
I just
really
read
help
your
you.
book. Like, exactly.
Yeah.
Here's a
Yeah.
card, go to toothpillow.com. I don't know. Here.
That's so funny. I think about that all the time. I'm like, oh, they probably
Yeah,
snore.
exactly. Or they
Yeah.
are and they're snoring on the airplane.
Yeah.
They're like mouth open, head back,
Yeah.
and or stop breathing. I was actually on a flight to Europe last summer, and the guy next to us was wearing a CPAP, and I was just proud of him for bringing it. But I was just like, oh, it's
He did.
wild.
He needed to
He did.
breathe. So
Yeah.
yeah. So one important question I get asked a lot too is about what is the ideal age to do guidance appliance therapy? And I want to preface this by saying, if someone has an interest in getting their child assessed or looked at for this, they can go to an in-person airway dentist, or they could do the program that my son did. And so the general like answer for this is that any age can get helped for airway.
Right.
However, children's growth is done by a certain point, and so there is an
Right.
ideal window, regardless which program, whether in person or not, to get your
Absolutely.
child assessed for this. But I do want to clarify that it is never too late
Absolutely.
to get help, but there is an ideal window.
Absolutely. So we start as young as 3 in my private practice and with this virtual platform. And I like the earlier the better. When you start at 3, it's going to take your kid a little bit longer to keep it in all night and wear it. I started my son at 3 to shrink his tonsils and adenoids, which we were successful in doing. But it took him almost 6 months till he kept it in all night. And that's okay because he's little and we have so much time. But by age 12, a boy's head and neck development is 90% complete and a girl's is 94% complete. So typically by that age, a lot of damage has already happened. The palate is more and more solidified and formed, and we have to go in with custom expanders and things like that to get it right. You're right, we can do it, but honest to goodness, the earlier the better.
Right. And it's, and just to briefly talk on this, expanders. So a lot of orthodontists will do upper expanders. And when you say expanders in an airway dentistry, it's upper and lower. And
Absolutely.
also, regardless of that, still working on myofunctional therapy or and getting the
Yeah,
tongue to the roof of the mouth. Because at the root of all this, it's a tongue
it
dysfunction, the tongue
is.
not being where it needs to be. And so these guides also help train that. And when you start younger, that habit can develop
So much
much
earlier
easier.
in life. Yes,
Yeah.
absolutely. Nope, you're right.
I've been more conscious of it, and starting to share my son's story. I started learning about mewing, which I didn't know
Yes.
about, and I thought all these people were like trolls talking about mewing. And then I started like looking into it, and I'm like, oh, this is a thing. Like
Yeah,
this whole young
myofunctional
generation,
therapy.
yeah,
Yeah.
they're trying to get this looks maxing, snatch jaw, and it's all about like that tongue suction to the roof of the mouth. And I do keep my tongue there, but it's not like as much as I think it should be. I think I'm like lightly
Yeah.
touching, and I hate these things when they do that.
I know.
But yeah, it's very interesting, and I do want to just like really point out for anyone who has a child, the earlier the better. And after 12, it gets much more difficult and harder to establish those habits and have as much success in
Yes,
that growth. But
absolutely.
I'm excited to one day get treatment, and
Oh, well, I would love to
I
help
want
you
to do that.
anytime.
Yeah. That's like one of my on my to-do list is that I want
Good.
I want to do that.
Yeah,
So
good.
but thank you. I also wanted to answer a question as far as like any parents watching this and they're like, I think my child has all these symptoms. My child is showing signs of this. I don't even know if my child is showing signs of this. What would be like the first step to find out if this is an issue that they have? And I would love for you to discuss both someone with symptoms and a parent who doesn't think this necessarily applies to their
Yeah.
child.
Yeah, well, the easiest way, I mean, the whole reason we built Toothpill in the first place was to just give parents a place to go to be able to submit for an assessment for their child. And even if you think your child is doing just fine, like they sleep 12 hours a night, we have no idea what that quality is. And it takes little effort to submit them through our platform so that we can just look and tell you, I hope you don't need, your child doesn't need anything. That is my hope, is that I look at it and I'm like, you are a unicorn, you are a perfectly developing nasal breathing child. But that's just the odds of that are very, very low. So I would recommend, regardless if your child has symptoms, to submit the photos orthodontically and dentally. You will get a really awesome sort of plan for what we think your child needs if they need anything. And again, the earlier you start, the better. So if you start having symptoms, you might not, your child might be 5 right now and you don't think anything of it. And by 8, it's a totally different story. When had you started back when they were 5, they would be way ahead as far as their growth and development. And
Right.
obviously, yeah, go
No, I was
ahead.
going to say in Toothpillow, they don't approve all children. Like
Correct.
there are some
Unfortunately,
kids,
we
yeah,
can't. Yeah,
yeah, because some kids do need that in-person care. So
right.
one thing I always try to explain in my post is like, regardless of whether you want to go in person or you want to do a virtual program, getting your child assessed, it's absolutely free. It's easy. It's from
Yes.
home, and
Yeah.
you can get an awesome evaluation. That evaluation just changed everything for me. I was at a point of looking at getting a tonsillectomy. I was trying to get it scheduled with an ENT. I had to deal with the insurance and getting like the referral and all that. I went through all of that. I was very close to doing the tonsillectomy. And my friend, like I said, told me about this. And it was my last ditch Hail Mary, like, give this a try. And so I did the assessment and I did the video assessment, which if someone comments airway in the comments below, I'll send the information on how to get that video upgrade for free. But that video was literally everything for me. I had pictures of my son pulled up, an explanation of like what was going on, like even recognizing that his ears were not like lined up, like things I
Perfectly
never
like,
really looked at. Cause I was
yeah,
like, he's my cute little boy. Like, I'm not
exactly.
like looking at him like your face is
Of
crooked, And so
course.
now I'm like, oh my God, your face was super crooked, and like things weren't like growing
Right,
correctly, the
right.
dark circles and the long, narrow face. And his teeth, he was just starting to get his teeth in, but now looking at like how much his whole bite has
Oh, it's
changed. He
wild.
had a major overbite.
Yeah,
I didn't really know that. I had
yeah.
like braces wasn't on my radar. I was just like in his bed every night, like stop snoring, like turning him over, changing
Gosh,
pillows,
oh,
like
that's
trying
so
every
sad.
single oil I could, like literally
Yes,
everything to get him to breathe. And I didn't know like that he had all of this going on. So
yeah,
the assessment showed me like his bite was wrong, his chin, was recessed, like all of this was impacting his airway.
totally.
And now looking at my scans, side to side, like you can see how that bite affected all that. So
Right.
that assessment changed like literally his entire life. And I'm so grateful I did that assessment, even if it was a Hail Mary and I thought I was going to go do the tonsillectomy. I changed all my plans at that point and I
Yeah.
just decided to give this program a try. But I didn't know that I was making like a decision that would not just change my son's life, but so many other families' lives, because now I have this ability to share his
Yeah.
story and help so
Is
many other
so
families.
powerful and honestly just makes me emotional because that was the whole goal for us. We knew that if we could get the moms to know what we could offer them, like the heart and souls of the dentists that are in Toothpillow have nothing but will and help to change the narrative in dentistry and how we can help these kids. And it's so crazy. I'm just sitting here listening to you going like the fact that I played any sort of role in this is just wild for me. And the sky's the limit. I mean, we have thousands and thousands of kids in the United States and abroad that need this. And like you said, you didn't know what you didn't know, and there is no harm in an assessment. You're getting a very qualified, high valued opinion from somebody that's going to be
There's
able to tell you exactly what your kid needs.
there's nowhere that you can get an assessment from a doctor,
Doctor,
like not just like a little brief, yeah, your kid needs this. It's like a really in-depth
thank you.
assessment where you take a lot of time, and it's screened by you and Dr. Ben Moralia, and then it also goes to the state provider for a secondary screening, who then sends this full-blown assessment, and all for free. That's a lot of time on the
It
doctor.
is.
And these
Thank
are
you for
doctors
saying
with
that.
they're full practices. These are practicing
Absolutely.
airway dentists
Yep.
in an industry where there's not a lot of them, and they're taking their extra time to send these assessments to all of these children virtually because of the mission of helping all these children. So I
100%.
want to thank you for
Thank
like
you.
being part of creating this, because I want to talk, we've talked a lot about Toothpillow without talking about it. So I want to talk about like what exactly is this program. So what I do know is that airway dentistry is a very small industry right now. There are not a lot of you, and you're out there trying to help as many people as possible. And so you can help like your local populace with whoever comes into your office, and you can only help so many in a day. But there are like however many children that need this, a lot, like probably most children who need this,
Yes, most everybody.
who
Yeah.
don't have an airway dentist near them. And so this was a way to be able to reach all these children, make it accessible for families to get their children assessed, to find out if this is an issue, and if it is, to provide a way for them to get help for their children virtually. And how did that come about, and like knowing that you could help children virtually with something like their teeth and their airway? Like that's a really fascinating
Well,
like
thanks for asking.
platform.
Actually, I don't think anybody's ever asked me that before. So it was blood, sweat, and tears of treating thousands of patients in private practice and having people learn about me and fly to see me from other states. So what was happening is there was this wildfire spread of patients that needed care that they couldn't find or didn't trust in their community. And Texas is huge. So even if you were coming to me from the other side of Houston, you drove 2 hours, like whatever it was. And it was thanks to the other founders of this company and my husband to figure out the technology that we needed, because I knew exactly after doing it, like I can do it in my sleep, pun intended. Like after doing this for so long, I know exactly what size that the kid needs based on photos and assessments of their bite. I can do it. I just knew I could do it. And I knew that the fact that I could do it meant I could replicate it and that I could teach other doctors how to do it, and that my experience alone meant that this was going to be safe and effective for the kids. These can't do any harm anyway. And the just, yeah, so experience,
Yeah.
I guess, is the easiest answer, like truly experience, and then just figuring out how can we help them to feel my love and connection and the love and connection from their provider when they're not knee to knee with us. That's another really tricky part of all of this. It's like, well, who are these people anyway? And I don't know Kalli Hale, and I don't know Ben Routy, like whatever. And it's like, we're the best ones in the world.
Mhm.
It's so hard to say, like, I'm not trying to be conceited, but we know what we're doing and we
Yeah.
want that for your family.
Yeah, and I love that, knowing how much went into creating this and how it naturally came about because you were helping people virtually because
Yes.
of need. Like
Need.
there wasn't enough
Yes.
to help them. And then just to add to that, the guides that you are using, like my son takes these pictures and videos with this guide in his mouth, and people are like, okay, I like this guide. But these guides are not
No.
new. They're not new technology. They've been around, what, over 20
Yes.
years, and it's Vivos and MyoBrace are the brands that Toothpillow uses the guides
Yes.
of. And it's not just one guide. Like it's a 2-year program
Correct.
where you help and you connect with us over 2 years. There's a whole care team,
Yep.
and you watch the progress.
Yes.
And my son just started his second guide. So he graduated from his starter guide into his more advanced guide. And anything over 2 years span that we need, and even beyond if needed. And then my youngest started and he got his guide. And my
Oh,
boys were laughing because his starter guide was so much smaller than
yeah.
my oldest guide.
Yeah.
And I was like, is this gonna fit? It looks so tiny. And we put it in his mouth and it fit perfect. And so I'm very impressed at
Thanks.
the ability to take these photos and the technology that Toothpillow implements to be able to like
Mhm.
measure and do all that through photos.
Thank you.
So I really love
Yeah.
that.
Thank you. Yeah, it's really revolutionary, and you are right. There is not another one like us right now. And yeah, so I really appreciate all that. Your perspective on it as a mom and is really powerful, because I always am looking at things through the lens truly of just a dentist, a dentist, a dentist, and what we need to do. And so yeah, I appreciate you saying that. But yeah, it is a 24-month virtual program, and we do have, we're not going to just ditch you after that. We have lots of ways for you to stay involved with us afterwards. And yeah, you'll usually have 2 to 3 sizes. I would say on average, if they're starting later, 7, 8, 9, you're probably going to have like 2 sizes total, but depending on the age. So
Yeah.
yeah.
Yeah, and I just also wanted to touch on a question I get a lot, and I think it would be very helpful for anyone watching this. Is like there's a lot of worry about like, well, my kid's not going to wear it, and so like, should I even get them assessed? Should I even try? Because I don't think my kid's going to wear it. And you touched earlier on how your child also had a bit of a hard time wearing it, and my youngest is in the same situation. My eldest was so easy; he just like wore it, and my youngest, what we started with was just kind of like daytime
Good.
wear. Like if you want to watch this movie, like you got to wear your guide.
Yes, I love it.
And we just made it like part of daytime wear. And then he would try to fall asleep with it, but it would fall out in his
Yeah.
sleep. And
Yeah.
so he kept waking up without it. And then I started paying more attention to this myofunctional therapy. I didn't think about it for my eldest because
Yeah.
he was just so easy. And then the youngest, now we're doing more myofunctional therapy, and he started wearing it through the night. And so,
Amazing.
and it's, I really want to like address this because my youngest, and I've been thinking about this, I would have never gotten him assessed or looked into this if it wasn't for my
Yeah.
eldest. If my youngest was like my only child and I had no other reason, like he's great, like he has no medical issues versus my eldest who had like everything under the sun.
Yeah. Yes.
I would have never thought anything of it. And now I look at him and I see how underdeveloped he is, and I see how tired he is and
Yeah.
cranky. And he must have really bad muscle function because he
Yeah.
also struggles to eat
Yeah.
meat. He like
Yeah. Oh, well, then
picky
you're
eating. I
right.
would have never thought about the picky eating. He loves meat, so it's
Yeah.
not like he doesn't want to eat it. He like, I can't chew this. I can't chew
Oh
this. And
my
I'm like, eat your meat.
God.
Like
Yeah.
I'm like, just like stop being picky. Like
Yeah.
whatever. Just eat your meat. And now I'm like, oh my gosh, he's been like struggling to eat this, and I would have let him go for years
Wow.
with this
Totally.
without
Because
like
what? Because you
addressing.
wouldn't know either
Right.
way. Yeah.
So for parents, I wanted to talk about this because there is this worry that like if your kid doesn't keep it in, and I would like to for you to speak a little bit on like why that's okay in the beginning and
Yeah.
normal and like part of the process.
Yeah. So, I mean, they just have to be given a little bit of grace so that they can figure out what's going on. I mean, I relate it to like adult that's wearing a retainer or orthodontic appliance, maybe a night guard. Like that's gonna be very weird the first time you do it, in the first week maybe of sleeping with one. And our kids are little; they don't have half the regulatory ability in their brain to just like understand what's going on. And the younger they are, the harder that is. But every child is different. Like literally, of my three and your two that you talked about, like I had two that were super easy and one that was like really, really hard.
Mhm.
Like, come on, can't you just do it? And she was my tongue-tied one, and she was my muscle dysfunction one. And it was just like, oh, okay, I'm sorry. You actually like might need a little bit more time, you know? And so I always tell parents, like in my private practice every day, I'm just like, listen, make this fun. Don't get in your head that you dropped a bunch of money and it's not working immediately. Like, just calm down. Like, I've got it. I'm going to see them at their checks and we're going to make sure everything's happening. And there's nothing I haven't seen or heard, so I promise we're going to get from A to Z. Everything that happens between A to Z is noise. Like, it just is, and it's a distraction, and it's going to be okay. We're going to figure it out. So there's just not a lot to worry about. And when parents say like, well, I don't even know if I should bother because there's just no way they're going to do it, I just take a moment to explain the consequences of sleep disordered breathing. And when I know your child has it and I'm looking at photos or I'm in their chair with them and I see it, I feel in that moment an intense amount of pressure to get this parent to understand for the child's sake. Because I know how this is going to age. I know what's going to happen to the teeth. I know what's going to happen to their brain while they're developing. But how do I explain that in a way that the parents trust me and are willing to go through with the treatment? And I
Yeah.
usually tell them, as daunting as it may seem, because you've got to do bedtime and brush their teeth and put on their pajamas and like everything else, you have to let them try.
Mhm.
Don't assume they can't do it, because the consequences of that vastly outweigh. So you've got to let them try. That's what I say.
Yeah, and the path that you're talking about very gently is that they will essentially grow up with like a major sleep disorder, breathing,
Absolutely.
sleep apnea, CPAP,
Correct.
very crooked teeth, needing
Cardiovascular
like all of,
disease, high
yeah.
blood pressure, like insulin, glucose dysregulation. I mean, there's so many that I could talk about that I'm trying to prevent so that your child doesn't deal with that as an adult, like half the population
Right,
is.
and the research continues to come
It does.
out that it is affecting so many systems of our body. And so yes, there is like the teeth grinding and the snoring and all that, but there is a lot of hidden symptoms that we don't see until we grow up and age. And
Right.
you know,
Absolutely.
and
Yeah.
and then one other factor too is you mentioned teeth, and I do see a lot of people go like, well, my kid has perfect teeth, and they're like little, and their teeth are perfect, and they look like mine, like all right
Yes.
next to each other. Not that my teeth
Yeah.
are perfect, but I
Yeah.
mean, like they just like
Exactly. All touching. Like,
lined
yeah.
up. And so we know that those baby teeth are going to turn into very crooked adult teeth. And that's
Absolutely.
because there needs to be space between the
100%.
teeth. Can you explain a little bit about that?
Yes. Yeah, so in dentistry, it's called primary spacing because the baby teeth are called primary teeth. And so if I look at a kid and they don't have any space in between their teeth, that's going to be a crowded child. That is not a child that has a beautiful smile. That is a child that's going to struggle and need braces, aka really just a tooth pillow, because they're not expanding naturally like they should. So your child should have gaps between every baby tooth, including the molars. That's super, because some kids, they'll see a little bit like, okay, I'm good. Let us decide that. Submit for an
Yeah.
assessment. Let me use my very highly trained airway dental eyes to tell you yes or no.
Right. And then that goes to like the wisdom teeth conversation that like even if possibly like they're still going to need wisdom teeth removed, and in airway dentistry like there's a high success rate of being able to keep wisdom teeth if you
Absolutely.
start young.
Yeah.
And so I find that just so fascinating that we've just been like, oh, it's normal to lose your wisdom
Rip them
teeth.
out. Yeah.
And it's because we're just like shrinking
We
generationally. And
are.
that's a
We
whole other
are.
rabbit hole, but
It is.
we get into that. But
Yeah.
it is, I just wanted to bring up braces because I do know that even if you don't see symptoms, if you want to try to avoid braces for your child, like getting assessed for an airway like assessment will help determine whether you can
Absolutely.
avoid braces
Yep.
later and or at least minimize it. But so there's just so many benefits to getting your child assessed, and I don't know of a single one. Like I don't know if there's any single excuse to not get your child
You're
assessed.
right. There's not. I can't think of one
It's
because
free, it's easy
yes.
from home,
Yes.
and so yeah, and so I know that that there's just so many families out there that their children need help, and if they don't recognize it, like you can recognize it and see and
Absolutely.
help and just really help find answers for these children.
Yeah.
And even if it's not like right now that they're seeing it, they will see it. And
Absolutely.
I just find it just amazing that you guys have figured this out and really focused on building this company to help all these
Yeah.
children.
Well, I appreciate it. You're so kind. And it's platforms like yours that help me to reach more people because I'm just one person in Texas and we have this massive company and we are so excited for the world to know about it. So I do appreciate you taking the time in your evening to even have me on and talk about teeth because it's just so important. And I hope everybody will go to toothpillow.com and submit their child for an assessment.
Yeah. And if they put Soch or Soshana, who referred them, they can get $200 off treatment, and also use Soch to get a free video upgrade. It's SOSH, or just comment airway below and it will automatically send you the information. I did, if you have a moment, I do have a couple questions in here.
Oh, good.
I don't know if
Sure.
you mind, and I really do appreciate your time. I know
Yeah.
like you are very high demand and busy, so I do appreciate it. But I thought this was a really good question. Is it important to start before or after their adult teeth come in?
Oh, great question. Yes, before adult teeth come in. So the earlier the better, starting at age 3 with all the baby teeth. We don't want to wait till all the baby teeth fall out before we start doing things because the kids are a little bit too developed at that point.
Okay, awesome. And then I had one earlier that was about cavities and
Mm.
what the effect of mouth breathing is on cavities. And I do find this like a really fun little
Yeah. So cavities, mouth breathing causes an incredible amount of tooth decay. Incredible amount. So I don't care how clean your kid's diet is. I have moms that come in and they're like, we are grain free, sugar free. I floss their teeth and I'm finding cavities all over the place. And even in dental school, I would have just like hounded them about oral hygiene and sugar and like all of that, which I mean, that is all still very important, but you cannot outbrush the mouth breathing. You really can't. And it is so important to understand. And when I tell moms, like, this isn't your fault, they usually just burst into tears because we carry so much mom guilt, just like we were talking about earlier. Like, my kid got a cavity. How could that happen? I'm a bad mom. I wasn't taking care of it. And like, your child, you were just never taught to look for mouth breathing. And had you looked for that and known to look for that, you would have been in here and we would have been talking about it. And luckily, we can fix it. They're baby teeth and we have 2 sets, but yeah, mouth breathing is terrible. And we actually have literature to support that kids wearing the Vivos Guide appliance, the tooth pillow appliance, is the decay rate plummets. So when I check a kid that's been wearing a Vivos guide or a my brace in my practice, I'm like, oh yeah, no surprise, no cavities, because these kids don't get cavities when they wear them. So anyways, it's just wild. That's a long answer for
No,
a short question.
it's great. It's such like it's neat because that's one of the biggest problems and one of the biggest reasons parents go to the dentist is
Yeah.
because of cavities.
Yeah.
And the dentists are just filling it or, just whatever methods they're doing for that specific child or putting crowns, whatever. And like it could have been dealt with if
Right.
we had addressed airway issues early. Sorry, the questions are coming in here. Does Toothpillow teach the tongue to rest properly up?
Correct.
And so I know the answer. I
Yes.
love, but I would love if you would also explain the facial muscles in addition
Yes.
to that.
So it helps get the lips and the tongue off the teeth. And those facial muscles are very dictating where the teeth are. So people don't realize that your lips and your tongue are kind of your braces, and they can put your teeth in positions that are not good positions when they're in dysfunction or they're weak. Or, imagine if you're sucking on a pacifier or a thumb, you're pushing in a lot, and that can make the jaws more narrow. So yeah, the tooth pillow gets the lips and the tongue off the teeth, helps the tongue go to the roof of the mouth, and helps everything to expand naturally like it should.
Yeah, and that was the first time I heard that. It was a Dr. Ben webinar, and I always just like thought the guides, helped like channel the tongue up to the roof of the mouth. And I
Mhm.
thought that was kind of like the extent of it. And
Yeah,
when he explained that they also remove these muscles from functioning during swallow patterns, and that's why
right.
daytime wear, like an hour a day of daytime is helpful
Absolutely.
because of that, I was really mind blown. And there was a discussion about like swallowing water and how many muscles we use to swallow water, and we really should not be using them. It should just be
Absolutely.
like our tongue. And so
Yeah,
now I'm like, oh man, like we use our muscles, like our face muscles, to compensate
we
for our
do.
tongue, and it's all
Absolutely.
backwards.
It
It's all
is.
backwards.
You're
And so
absolutely right. Yeah.
yeah. Well, I do know you had a really busy week. We were talking earlier. So
Yes,
I really do appreciate
of
you taking
course.
time with me and educating on the program that we use. And I'm really hoping that parents hear this and understand like how important it is to get their child assessed, because it's not just like right now. This is literally their entire life, and all of us should have been assessed when we were
A hundred
little,
percent. Yeah.
and we are all functioning in dysfunction and just kind of normalizing it. And our children don't need that future.
Absolutely. Well, thank you so much, Shoshana. Seriously, it's been so fun meeting you, getting to know you, and you're an amazing mom. And I appreciate you shouting this from the rooftops. I need more people talking about it with me,
Yeah.
and it's been awesome. And thank you for having me tonight.
Thank you, Dr. Callie.
You have a good night.
You too. Bye.